But as part of this, I went ahead and looked at some of the literature, and I think, we can have long conversations, but we're not going to about this federal administration because there's lots of opinions. But I think we can all agree that at the very least, this administration is unpredictable. So I went and did a little bit of research on kind of managing in unpredictable environments. Found a really nice Harvard Business Review article that summarized several different things. So I thought I might add that to this conversation to take it out of kind of just from our perspective to kind of a higher level that any business who deals in an unpredictable environment has to face. And so, this is what are you not going to do anymore? Figuring out those things that really don't add value or not as much value that you cannot afford to subsidize like you used to. If you have, and this is not just books of business, it's also why do we do this process? Well, we've always done it that way. And take some time to do some flow charting and figure out, when I send this note to Dom, I've done it for 20 years and Dom throws it in the wastebasket. Maybe we don't need to do that anymore. And things like that can start cleaning up the internal processes, just getting things made a lot simpler for what you have to do, and both for your staff and for your end users. I've ranted many times about how we really don't do intakes very well in this industry, and part of that is externally imposed requirements. But if you start thinking strategically about how do we redo that, and I just wrote some more about that on a blog post that just went up recently, that you could that's one example of something that could be simplified. We often have overlapping structures. I remember one of the most meaningful things I did when I took over the mental health center was merging our outpatient mental health department with our substance use department. And because they were both seeing each other's clients, but they weren't thinking about these clients as duly diagnosed, or at least thinking holistically about their care. So that helped integrate some functions, and I think thinking seriously about what do we have multiple people doing that we still have to do, but we can simplify that. And this is where your vendors can come in, like particularly with your EHR vendors. What can we clean up on the UX for our EHRs and other tools? How can we make this stuff more helpful? And in terms of internal reporting, what tools could we use? Maybe a business intelligence tool instead of sending out Excel spreadsheets all the time. Keep those kind of interfaces cleaner and make them more usable for organizations, and get the junk off the desk of people that doesn't add any value to their jobs. I know it's tempting. It's scary to think about cutting a service that treats a vulnerable population. So consider maybe just suspending it for now, saying we're not going to get rid of that program forever, but we do have to stop it until we know that we can afford to continue to subsidize it. So those are and I think that's it's a little bit more palatable for me personally when I was in this business, but doing clinical supervision and managing an organization, and also for boards, because the boards have an investment in treating these populations. And finally, kind of, again, back to your vendors, looking at how do we abstract kind of what's on the back end, how do we clean that up so that the end users aren't having to go into 6 different systems to find something or to integrate something.